Video response time. You might want to pull up a chair. Okay, it's time. Video response time. Doing a bit of a vlog in response to a polarizing and hot conversation on Twitter a while ago. The original statement happened while I was working a string of shifts, so I just didn't have the time. Now that I've had the time, I get to respond. I should say ahead of time that I've had the luxury and opportunity to let this sink and simmer. I've had time to contemplate and think about it. I've also had the time to watch this play out over the past several days from both sides. So my views might be a little unfair compared to those with the knee-jerk reflex when it originally happened, because I might have done the same thing. Let's set the stage. So to start with, I'm going to share with you the screenshots of the original statement from, and I have to look at her name, from Leah Houston, who is, according to the internet, a physician. So check them out. Okay, so let's hold our comments until the end. And this post on Twitter, I don't know what was the catalyst for it. I knew nothing about this particular person until I had to literally Google and look up what was going on. It was brought to my attention through Instagram, through another popular Instagram account. I think it was Nurse, literally looking at my phone while we do this, Nurse Life RN. They posted it, and there were thousands, almost 3,000 comments have been posted, and I'm guessing this has been about 5 days. A couple of the more popular and well-known nurse influence out there have responded. A couple of them are nurse practitioners. And so what I know is that she is a physician and she has particular opinions about APPs, both nurse practitioners. She's talking about nurse practitioners, but I think she blankets it for all APPs. For those that don't know anything about me, or you're just hanging out to listen to the response, I am a nurse practitioner. I've been in the field of nursing for 15 years. Worked in critical care my entire career. I've been a nurse practitioner in the ICU for 7 years. And I've pretty much done and seen it all when it comes to the world of ICU. We're going to leave it at that. So there's a lot of things that are brewing in my mind, and I have a couple notes. I'm going to address a couple things that this particular person, this physician, talks about. First thing I want to talk about is she was out to pick a fight. I mean, let's be honest here. It's not that she wasn't, and I'm kind of hoping that this gets to her and maybe she can see this video. Hint, hint. Maybe my tribe can help me out with that. I feel like she's literally picking a fight. If she has taken issue with what APPs represent and the topics that she's referring to, don't you think there was a better way to address it? A more professional and engaging manner to have an open discussion instead of high school, grade school, preschool antics of being on the playground and pointing fingers. Everyone has the right to their opinion. I completely agree, and I'm okay with that. You can express your opinion in any way, shape you want. But if it's at the expense of other people, then that's when you might want to rethink your approach. I think everybody would agree that as a professional, even she comments on this, is that you have to pay attention to what you're saying out there. And if you're going to address and or point fingers at another healthcare profession who your profession works with shoulder to shoulder across the nation, I think probably you could have said it a bit differently. So let's talk about the topics that she's addressing. So the very first one, and once again, I'm reading this directly from my phone. If you can scroll back, you can look at the screenshots that I'll share with you. The first thing is that she's claiming that nurse practitioners have carte blanche and they're able to say whatever they want on the internet with no repercussions. In her words, interesting thing is if a physician said the F word on Twitter, they could be fired for it, but a nurse practitioner, they don't get fired for anything. Poor outcomes, foul mouth, it all seems to be okay in the field of nursing. So she's claiming that on the social internet stage that nurse practitioners have no repercussions. And I'm fairly certain that we have several instances where nurse practitioners have made missteps and they've either been disciplined or they've been fired. In fact, there's a very popular, prolific, and well-known nurse practitioner and nurse influencer who literally lost their job because of questionable actions online regarding HIPAA violations. It's not a secret. You can go look it up. Now, the whole F-bomb, and she's relating foul language to poor outcomes. That's a far stretch because I know very intelligent, successful physicians who promote free open access medical education, and they've sworn, they've utilized foul language. I guess it all depends on what your intent, your message is, and who you're representing. Because if you're representing yourself and not an entity or an employer, then you can say whatever you want. Once again, it's your opinion, as long as you're not harming someone. Case in point, I use F-bombs all the time. I swear all the time. If you follow me on Instagram. On YouTube, of course, I don't swear because of their restricted policies. They have rules and regulations. If you're interested in any kind of affiliate passive income, you can't swear. Well, guess what? I don't swear on my YouTube channel because I'm interested in the affiliate program and the AdSense through Google. It's pretty self-explanatory. I don't think swearing equals bad outcomes. And the swearing and bad outcomes is not exclusive to APPs. Pretty sure there are physicians out there that have equally bad outcomes and also have foul mouths. So, once again, pretty sure that this person was picking a fight. The second thing is, we're not even going to talk about this, is that she made some sort of horrible comparison to abolition of slavery. I mean, wow, I'm not even going to comment on that because that was just bad. And my understanding is she apologized for that later in her Twitter feed. So, wow, we're not even going there. So then she talks about she apparently ganged up on several users on Twitter, and she's stating, "Have you ever had to tell a patient that their leg was amputated because a non-physician misdiagnosed them?" Once again, not exclusive to APPs, not exclusive to non-physicians. Fairly certain, it's fairly public knowledge, there are surgeons and there are physicians that are equally at fault regarding these mistakes. And it's my understanding that it is exactly what I just said. It's a mistake. Physicians and surgeons are not infallible to mistakes. So, picking a fight. Going back to that over and over again. The last part I do want to spend a little bit more time with is that the end result of the AANP, which is the American Association of Nurse Practitioners, which is the national organization for most of the nurse practitioners in the United States, that the AANP pushing and promoting the false rhetoric that NP curriculum education is appropriate. She says, I have seen it, we all have, we are constantly cleaning up messes. The situation is dangerous and out of control. She has an issue with APPs, period. Let alone nurse practitioners. She seems to have a target on a nurse practitioner's back, on the nurse practitioner profession in general. Because, once again, I'm not quite understanding why NPs are exclusive to these messes that she's talking about. So, let's talk a little bit about that. So, initially, the way I looked at it from a lot of perspectives on Twitter, on Instagram, and on Facebook, is that the nursing profession, the NP profession, everybody that I saw, they took issue with it, they rebutted, their knee-jerk reflex was to go on the attack. That this physician doesn't know what they're talking about. How dare they? Go look at the several studies that have reviewed and have confirmed that nurse practitioners improve outcomes. I looked at some of the timeline on her Twitter feed and then some of the outlier conversations that talk about needless, unwanted, and additional testing. She was micromanaging, and she was literally putting nurse practitioners under a microscope and evaluating all of the minuscule things that they may not do well or that they don't do as well as physicians. The bottom line is we're not physicians. Maybe that's her issue. Maybe that's the point of this whole conversation, is that there is a strong percentage of the medical community, the physician community, that do not agree, passionately do not agree with nurse practitioners vying for independent practice. And there are several states that already allow it. Several states where a nurse practitioner does not need physician oversight. And for those that don't understand that concept, what it comes down to is, I, as a nurse practitioner in the state where I practice, I require a collaborative agreement with a physician. My practice is dependent upon the collaborative agreement with a physician who oversees all of the things that I do, all of the orders that I make, all of the tests that I order, all of my plans, diagnoses. They oversee it. From a state perspective, it's the law where I work and practice. There are states out there where, after a certain number of years, certain number of clinical hours that have been documented, you don't have to have physician oversight. You can practice independently. You can function as close to a physician without being a physician. And if you're familiar with my channel, my social media presence at all, you know that I take issue with this because I'm not a supporter of independent practice, with a lot of caveats. In my state, we are currently lobbying for independent practice, and the rules or the guidelines that they're setting forth or that they're proposing is that basically a nurse practitioner, as long as they've had roughly 2 years of practice experience, they graduate from nurse practitioner school and they go and work out in the workforce and whatever specialty they're in. Most of this is geared towards primary care as a sidebar. that after 2 years of working, they could apply and gain independent practice. So they would no longer need the oversight of a physician. No collaboration. They would literally be functioning as an independent provider. And I take issue with that because I don't think that's enough time. Anyone that has been working this job for a hot second knows that that's not enough time. I think that if this were to be passed at the legislation, it should be 5 years, 4 years at least. You need to start paralleling our training experience to physician training experience. And I think that's where this issue lies, is that the physician community feels that NPs are not trained enough. And this particular physician has admitted on her Twitter feed that most of the things she's talking about are based in personal experience. That what she has seen in her personal, professional interactions at her job are why she feels the way she feels. And I think that's the take-home point. That's why we have such varying opinions about the function of the NP. Because not every NP is the same. And this is the part that is hard to swallow, a hard pill to swallow for the nursing profession, is that not every NP is the same. You know, the NP that is been working for 7, 8, 9, 10, 15 years is going to function very differently than an NP with 2 years experience. You could say the same thing about a physician. So let's talk about entry-level NP. If an NP plays their cards right, if they work the system the way that they can without violating any rules, laws, policies, an NP could go through NP school. A student could go through NP school, which would be roughly 2.5 years. You can do it full time. After 2.5 years of full-time work, from an online program, so you didn't step foot in a classroom, you did this WebEx thing, 2.5 years of online programs, and then during those 2 years you did your required clinical hours, which I think is roughly 800 hours. Some schools say 500, some schools say 1,000. So if you want to split it down into a third, into 1.5, you could say 750. 750 hours of clinical work, 2.5 years, and you could graduate with your nurse practitioner with a degree to sit for the nurse practitioner boards. Now, if you roll that back, you only need your bachelor's in nursing to start NP school, which is a minimum master's level education. So, if you tallied all of that education, if a high schooler went directly into nursing school, entry-level nursing school, they went through 4 years of bachelor's, 2.5 years of NP school, in 6.5 years of straight schooling with only student experience, they could be practicing as an NP. And then 2 years after that, they could be potentially working independently as a licensed provider. I don't think that's enough. From an NP perspective, our education and training is not as exhaustive and detailed as medical school and residency. And anyone that graduates from NP school and starts their first NP job, there's no way that you feel that you're ready to care for patients, because when you graduate from NP school, you are scared out of your mind. I think this physician and other physicians take issue with the minimum requirement. And I take issue with it too. As a seasoned NP who is now a preceptor, who is now an educator, I take issue with it as well. I think we should take a step back. First of all, the bottom line is that her comments, her statements were inflammatory. She's out to penalize every NP regardless. And I think her opinions are her opinions, just like all the other physicians have their own opinions. I think if we're to make any changes that are better for our patients, then we need to have engaging conversation, not this playground, he said, he said, finger pointing. And that's what this is about. I know that I'm going to get a whole bunch of comments from everybody who is interested, invested in this. If you've made it this far, I'd love to hear what you have to say. I have many videos that talk about my opinions in regards to the minimum with NP education. I don't know if I'll ever change my mind, because I remember what it was like when I started as a nurse practitioner. And when I started as an NP in the ICU, I had already had over a decade of nursing experience. And I was in the ICU the entire time. So my education in that specialty was fairly exhaustive from the nursing perspective. And I was unprepared when I started as an NP, just as every other NP is unprepared. I think that we need to either add a residency or we need to add more years of requirement before we decide to grant NPs independent practice. I think the manner in which that this physician delivered her opinions was wrong. I think it was inflammatory, I think it was accusatory, and she was just out to pick a fight. If she wants to have an engaging conversation to try and fix the problem, I'd be happy to chat with her. But I am not about to agree with any of the comments that she has made, because it sounds like she just takes issue with APPs, period. And she's not willing to listen or adjust her sails in any way. Daily Sean, I'm out.